Hi everyone, I would like to welcome you all to my webinar today, and it's all on exercises, the follow-up versus follow-up versus follow-up, and the compound modifier exercise and department capitalization. Okay, so my name is Lisa Thompson, and I will be presenting this, and Audrey Kirchner assisted on some of the exercises and whatnot. So together we came up with this, so I hope this helps. Okay, so the first exercise will be on follow-up, the different follow-ups, the noun, the verb, the adjective. So the first question would be, the patient will follow up in 2 weeks with her referring physician. So A would be a noun, B would be a verb, C would be an adjective. Okay. Next question, number 2, we are requesting that the patient have a follow-up mammogram in 6 months. Again, you would have A, noun, B, verb, and C, adverb to choose from. So I suggest when you're doing this, to take out a piece of paper and pen and try and test yourself, okay? Let's see here. Next question 3, the patient returned for follow-up after elective cholecystectomy. A, B, or C? 4, she will follow up with the baby's pediatrician in 6 weeks. And again, you would pick A, B, or C. Or it could actually be 2. 2 might fit. So you may want to think about that as well. Okay, 5, Mr. Jones was scheduled for a follow-up visit, but he failed to keep the appointment. So you have to decide whether it's A, B, C, A and B, A and C, B and C. So there is some answers that 2 things can fit, okay, just so you know. 6, the patient is here for follow-up. 7, a follow-up consult is required to confirm the effectiveness of treatment with chemotherapy. 8, follow-up ultrasonography is required to check the size of the cyst. 9, while I'm on vacation, the patient will follow up with my partner, Dr. Jones. 10, the need for a follow-up recheck was explained to the patient after sutures were removed. 11, patients seen in outpatient surgery are asked to follow up with their private physicians. 12, it is recommended that follow-up be carried out within 10 days after discharge. 13, most patients are asked to mandatorily follow up after inpatient procedures. 14, Ms. Smith returns for a follow-up following her emergent C-section. 15, the tubal ligation will be performed as a procedure to her vaginal delivery. And I have the answers here, but I will go back up to the first one so you can see it. Okay, so number 1, the answer would be B, the verb form of follow-up. Number 2, it would be both A or C. Okay, so it can be either the noun or you could use the adjective form. But in order to use an adjective form, the word following has to be a noun, which it is. So either one will be acceptable. 3 would be a noun. See here, an adjective wouldn't fit because after is not a noun, so you would have to use the noun form to be correct. Number 4 would be B, follow up, the verb. Number 5, again, would be A, the noun, or C, the adjective, because visit would be a noun. 6 would be a noun. So remember, you would use a noun when the patient has made the appointment, and the verb for action is when they're going to. So kind of keep that in mind. 7 again would be A or C. 8 would be A or C. 9 would be B, follow up. See, the patient will follow up with my partner, Dr. Jones. 10 is A or C. 11 is B, follow up, the verb. 12 is A, follow up, the noun. 13 is B, follow up, the verb. 14 is A, follow up. See, because the patient is returned for a follow up, so the appointment was already made and they're there, kind of thing. So 15 is A or C. And just as a hint too, remember, if will or to, the word will or the word to directly before follow-up, it will always be a verb. It'll always be 2 words. And just remember, for the adjective follow-up, it has to follow, a noun has to follow that, or else then you would have to use a noun. All right? So hopefully everybody did well on that or has learned something. So the next exercise will be compound modifiers. And you can find that in your BOSS 6.5.2. The first question is, the patient had a moderate-sized hiatal hernia. So you would pick A or B. Either it's hyphenated or it isn't. Number 2, the patient is 70 years old. Again, you would pick either the one that's hyphenated or the one that isn't. 3, entry was made into the posterior cul-de-sac. 4, she submitted an extremely well-written resume. 5, the baby's vaccinations are up to date. 6, the patient had a 3-month history of night sweats. 7, he presents as a child well appearing. Oh, I'm dyslexic, sorry. He presents as a well appearing child. So that would be he presents as a well appearing child. Sorry about that. 8, he had 2nd degree partial thickness burns. 9, there was noted to be a 2 centimeter mass on the ovary. Mass didn't have to really be there because it's already there, but that's okay. 10, I spoke with the patient's mother-in-law about the outcome of surgery. 11, the patient is a 40-year-old African American male. 12, he weighed 5 pounds 6 ounces at birth. 13, the patient had Charcot-Marie tooth disease. 14, the patient has oat cell carcinoma as his primary diagnosis. 15, the patient was ill-appearing upon interview. 16, I made a 2-inch incision to enter the abdomen. 17, Xanax was given in a 5 milligram dosage. 18, he presented with acute left-sided pain in the abdomen. 19, she delivered an 8-pound 7-ounce baby girl. 20, she can have a follow-up mammogram in 1 year. Thought I'd throw that in there to see if you learned anything from the other exercise. 21, the patient has a history of non-small cell carcinoma. 22, there was a cyst-like nodular structure on the pancreas. 23, she had chronic low back pain. 24, there was a dark brown lesion on the upper arm. 25, she had a recently completed set of lab tests. 'Your last one, 26, the patient presented as a squirming 4-year-old. So let's get to the answers. Okay, so the first one, the patient had a moderate-sized hiatal hernia. That would be hyphenated because moderate-sized is a compound, it's modifying the hiatal hernia, so that would be hyphenated. Number 2, it would have no hyphens because it comes at the end of the sentence. In order to have hyphens in there, it has to modify a noun. So if they said the patient is a 70-year-old female, then you would hyphenate that. And one big clue to look for, if they say years, then, and it was dictated correctly, that would never be hyphenated, because if you say 70 years old, anything that comes after that is usually a period or a comma, you know, something blah, blah, blah. But a noun never usually follows it. Okay. So the next one, the entry was made into the posterior cul-de-sac. Remember, that is always hyphenated. That word, always hyphenated. No matter where in the sentence it appears, it doesn't matter if there isn't a noun that follows, makes no difference. It'll always be read as a single unit. Okay? 4, she submitted an extremely well-written resume. So you do not use a hyphen in a compound modifier to link an adverb ending in ly with a I'm going to break up that word, participle or an adjective. So just remember that. The baby's vaccinations are up to date. And again, it's at the end of the sentence. A noun doesn't follow, so therefore you wouldn't use hyphens there. Okay? The patient had a 3-month history of night sweats. It would be hyphenated because 3 month is modifying the history. Okay? He presents as a well-appearing child. Anytime you have appearing, it should always be hyphenated because it wouldn't make sense to separate the two. I mean, the child can't present appearing. So it just wouldn't make sense. So that appearing, it would always be hyphenated. Okay. He had 2nd-degree partial thickness burns, and you can actually see the reference there on BOSS 17.1.3, and partial thickness is modifying the burns. There was to be a 2-centimeter mass on the ovary. You never hyphenate metric measures or metric measurements, so keep that in mind. Do not hyphenate that. And I don't know what exception on 652, because it's in 12. It always says not to hyphenate in chapter 12. So I should probably take that out of there. And it's BOSS 12.1. Something 5 or 2 or something like that. You'll find it if you go and look in there. Just save that. Okay, so number 10, I spoke with the patient's mother-in-law about the outcome of surgery. So that would be hyphenated because it's compound nouns and verbs. So you would hyphenate that, and there's your reference, 6.5.3. Okay. 11, the patient is a 40-year-old African-American male, and this would be a case that would be hyphenated because it's modifying African-American male. 12, he weighed 5 pounds, 6 ounces at birth. So here, you wouldn't use hyphenations on either one of these because it isn't modifying a noun. Okay, so just keep that in mind. So you would use, this would be the correct one when it isn't modifying a noun. And that's also in chapter 12 as well. The patient had Charcot-Marie tooth disease. Remember, 2 or more eponymic, however you pronounce that, names are hyphenated. So anytime something's named after a person, whatnot, you would always hyphenate. Okay. The patient has oat cell carcinoma as his primary diagnosis. Disease entities, when preceding a noun, most of them aren't hyphenated. Okay. And if you look at in BOSS 6.5.2, it'll show that and explain further. So most disease entities, remember that, are not hyphenated. Okay. 15, the patient was ill appearing upon interview. And here again, you have the word appearing, so you want to make sure that's hyphenated. So, and here's another little hint. Hyphenate compound modifiers that occur elsewhere in the sentence if they continue to function as modifying compounds. But you would always hyphenate appearing, anything with appearing anyway. So, I made a 2-inch incision to enter the abdomen. Now here, 2-inch is a modifying incision. Okay. Xanax was given in a 5 milligram dosage. No hyphen. We do not hyphenate metric measures, even if they function as a compound modifier. So remember that. Do not ever hyphenate that. Okay. He presents with acute left-sided pain in the abdomen. You would hyphenate that because it's modifying pain where the pain is. It's left-sided. Now, if they said he had pain on the left side, you wouldn't hyphenate that because it isn't modifying anything. She was delivered of an 8-pound, 7-ounce baby girl. Now here, sorry, I did the wrong one here. Let me. Let's see here. This color. There we go. Here you would have hyphens because it's modifying baby girl, which is a noun. Other than that, if they just said she was delivered 8-pound, 7-ounce, or she weighed 8 pounds, 7 ounces, then you would use this one here because it isn't modifying anything. Okay, so just remember that. Keep that in mind. The biggest thing for hyphenated words is if a noun follows. That's your biggest clue. So here, it would be B or C. So it would be your noun or your adjective form would fit there. Both would be acceptable. 21, the patient has a history of non-small cell carcinoma. Both are correct and acceptable with or without the hyphen here. They're more trending towards dropping the hyphen, but both are acceptable. see here, 22, there was a cyst-like nodular structure on the pancreas. And of course that would be hyphenated because it's modifying nodular structure, okay? She had chronic low back pain. Low back is one thing, so therefore it wouldn't require hyphenation, okay? (24) There was a dark brown lesion on the upper arm, and the same rules would apply as the last one. 25, she had a recently completed set of labs tests. And here you wouldn't, remember the rule, you wouldn't use a hyphen because this right here, this little fella right here with the ly, the adjective form, okay? So that's why that wouldn't be hyphenated. Oh, I stuttered here. We have 26, 26. The patient presents as a squirming 4-year-old, and again, it isn't modifying a noun, so therefore it wouldn't have hyphens. Okay, so I hope that cleared it up some and didn't confuse you more. And now our last exercise, to capitalize or not to capitalize. So examples of departments, divisions, and specialties. So let's see here. Oh, what did I do? Where are we at? Oh, I went the wrong way. We're on here. Okay. So the first one is the patient was seen at St. Joseph, and either A, B, or C. So either both words are capitalized, or just the first word's capitalized, or neither one of them are capitalized. So that's what you have to choose from. So the patient was seen at St. Joseph Emergency Department. Number 2, the patient will be seen by the ophthalmology service before discharge. And again, same kind of options. Either they're both capitalized, or neither one is capitalized, or just the first word is capitalized. Number 3, the patient had the biopsy submitted to pathology. To capitalize or not to capitalize? I am going to have hand surgery. See him before his next appointment with me. Same options. Five, the patient was seen by anesthesia preoperatively. The Department of Social Services will see her before discharge. Seven, I would suggest that he receive general induction anesthesia. 8, the radiology report showed no evidence of fracture. 9, I want her to follow up with cardiology in 2 weeks. 10, the patient will need to be seen by a cardiologist. 11, he was told to report to the emergency room for fever, headache, or chills. 12, he was seen at the urgent care yesterday because our office was closed. Okay, now we're ready for the answers. Let's see here. So number 1, the patient was seen at St. Joseph. Both of them, it would be B, both would be capitalized. And the reason why it's capitalized because it specifically tells you where the emergency department is located. Okay, so if they just said the patient was seen at the emergency department, then it wouldn't be hyphen or capitalized because it's non-specific. Like, where is this emergency department? We don't know. So if they have the name dictated, then it would be capitalized because it's specific. You know exactly where it's at. 2, the patient will be seen by the ophthalmology service before discharge. When they're just providing a service, you don't capitalize that, okay? Because that's just telling you what kind of service will be performed. So there's no need to capitalize. The patient had the biopsy submitted to pathology. Again, they're referring to the department. So anytime they're referring to the department, you would capitalize it. But just remember, if they said pathology department, then you wouldn't capitalize either one because then it turns non-specific. But if they're saying referring to the department without actually saying the word department, then you would capitalize. Okay, I know it gets confusing, but I don't make the rules. 4, I am going to have hand surgery. See him before his next appointment with me. Hand surgery, that's capitalized because they're referring him to the department. And that's a department in one of the clinics or hospitals. Hand surgery. The patient was seen by anesthesia preoperatively. And see there again, it would be capitalized because they're referring to the anesthesia department. Okay. The Department of Social Services will see her before discharge. Again, that wouldn't be capitalized because where is the Department of Social Services? Could be anywhere, at any place, right? So, non-specific. 7, I would suggest that he receive general induction anesthesia. See, they're referring to the anesthetic, so therefore they're not referring to the department. So therefore it wouldn't be capitalized. Okay. 8, the radiology reports show no evidence of a fracture. Again, that wouldn't be capitalized because they're not referring to the department. They're referring more to the service that was performed. So they're referring to the x-rays. 9, I want her to follow up with cardiology in 2 weeks. Again, referring to the department. So it would be capitalized. 10, the patient will need to be seen by a cardiologist. Would not be capitalized unless a name is dictated. And you can look in your capitalization chapter in your book of style. So no capitalization. He was told to report to the emergency room for fever, headache, or chills. Again, it would not be capitalized because it's non-specific. We don't know where the emergency room is. So neither one would be capitalized. He was seen at the urgent care yesterday because of our office was closed. Again, you don't know, it's non-specific. You don't know where the urgent care is located. So lowercase, both. Let's see. So for a hint, if you can replace a department with Dr. Smith and it makes sense, then it needs to be capitalized. So for example, he will be referred to orthopedics. So he will be referred to Dr. Smith. Well, that makes sense, right? So capitalize orthopedics. So that's just a hint. You can keep that in mind when you're trying to figure out, what to capitalize and what not to. So that concludes everything. I hope that you found these exercises helpful, and I hope that some stuff up for a few of you. And anyway, I hope everybody has a good evening and or a good day, depending on what time zone you're in. And this concludes it. Bye for now.